One of the techniques you mentioned there that may not be that well known is EMDR, which is eye movement desensitization and reprocessing. And in my understanding, it's a psychotherapy technique developed by Francine Shapiro. Maybe there might have been somebody before Francine, I'm not too sure. But she was a psychologist, and she wrote about it a lot in the late 80s. And when it emerged, to my knowledge, it was used to treat a lot of post-traumatic stress disorders or people with trauma. How do you incorporate something like EMDR? And I know each case is obviously confidential, but generally, how would you approach something like EMDR and bring it into a treatment?
I was fortunate enough to be trained early on. I was one of the early students of theirs. Went all the way from India to Denver, an act of faith because I didn't know how good it was going to be. Then I went back to New York, and again with Francine Shapiro, I did the thing. From the day one, I found we have to go through what we are doing in all the cases. Do unto yourself what you're going to do unto other people. So in all the training, we are going through we experience it first ourselves, which is a very good idea. And so I noticed, this is really good. What they're claiming is true. And it is not mind only, it is the body, and it brings many things together in that. But the power of that one to change people, and in those days, you are right, it was all trauma work that was involved in this. And it was unknown. Even a few years, when in India, of course, nobody had even heard about it. And when I came here, in the early years, here also nobody had heard about EMDR, surprisingly. And I began to use it only for those people. Plus, in sadhana, our work was mostly group therapy. So I used this only a few people who were traumatized in some way or other, genuine traumas. I used to use that. Then we found it is very good for even people with less, it's really clinically not a trauma. Those kind of things also we could use it. Even to strengthen positive qualities, we can use EMDR. So it's a very good one. It's a powerful thing. The good thing about it is this. Now, 25 years or more later, if one of those early people who came to me, with whom some of them I still know them and I contact with them, not one person has ever come back to me and said, oh, it was all very good when you did that and I felt fantastic, I changed, but it has come unstuck now.
Yes.
Nobody ever has said that, which is very remarkable for a thing like this.